Hello everyone. So we shall continue with topic three, continuation of topic number two. So topic number three will be talking about during treatment protocol. For specific learning outcomes, number one is to identify the risks again involved for patient based on the procedures and other factors. Number two, to demonstrate an appropriate protocol during patient care in a dental clinic or operatory room. Okay. All right, so what are the risks involved when you talk about having patients in the dental chair? So there are four main factors or risks, which are direct contact, indirect contact, contact of conjunctival, nasal, or oral mucosa, and also inhalation of airborne microorganisms. So as for direct contact, you can see you might have a risk of contacting the patient's blood, oral fluids like saliva or other infected materials during the dental treatment. So sometimes if you're not wearing a proper face shield or goggles, the blood may splash into your eyes or onto your face. So this is considered as direct contact. For indirect contact is when you touch with the contaminated objects such as instruments or environmental surfaces or equipment. For example, your computer keyboard, when you're not properly disinfect the keyboard, you might get transmission of these microorganisms. All right, number three, when we talk about contact of conjunctival, nasal, or oral mucosa, we're talking about droplets such as spatter, which contain a microorganism from an infected person. Also can be propelled by coughing, sneezing, or talking, or something else too. Number four, inhalation of airborne microorganism, which can remain suspended in the air or in your dental clinic room for a long period of time. So you have to understand the risk involved in the dental clinic. All right. Okay, let's look at the step-by-step protocol for handling patients during the dental treatment. So before you touch your patient, before you put on your gloves, wash your hands again before putting your gloves. And then put on your PPEs. Okay, step number three, you need to put on protective eyewear on your patients as well as bibs on the patient to protect their clothes. So just bear in mind that every patients that in the dental chair have a greater risk of having eye injury because we are simply using sharp instruments and a lot of water spatter and also spillage could occur during the dental treatment. So eyewear is a must for every single patient as well as the bibs for them to wear. Step number once glove. Again, remember only the patient and barrier covered areas or areas that have been cleaned and disinfected can be touched. All right, so just remember that. Do not touch others with your hands which have gloves on. So if you need to go get something, just unglove and put on a new glove later on. All right. It's very important for you to observe whenever you are doing any dental treatment that cause a lot of water spatter. You need to use a proper ventilation and also aspiration. So first of all, the dental clinic itself should have a good ventilation. And when you are doing dental treatment, Make sure that the aspiration part is taken care of. Okay, so you have to have a good equipment for this matter. And it is very important for you to remember that every time you are treating patient, you need to practice aseptic technique, especially when dealing with the sterile instruments, or especially when you're doing surgery on your patients. Okay. Number six, the patient chart. If you're still using the the paper-based record, you shall not be touched with your contaminated gloves. If you're using desktop, shall not touch the keyboard or mouse without having ungloved, or at least you must wrap it up with barrier film or film barrier. Okay. So the photo shows you how you wrap the pen or the mouse when treating the patient, so that to avoid for you to touch the pen or mouse with your gloves. Okay, so you could consider doing this in your clinic if you think that you're going to use while treating the patient. Okay, last but not least, please ensure that you adhere to all guidelines available when treating patients. So there are so many guidelines available for you to observe and adhere to when treating patients. For example, the spillage guidelines, um, using the PPEs, and all that. So please do remember that every step or every protocol, every guidelines are very important for you to observe. That's it for this topic. Thank you.